Hi, welcome to the Safeguarding in Schools webinar. I'm Emma Geiringer. I'm the Safeguarding in Schools lead from the Safeguarding in Schools team in Southwark. We run this regular webinar series, each on a different topic that is relevant to our Southwark schools. So today we're going to be looking at the topic of young people and substance use and thinking about how we can safeguard our pupils in relation to substance use. So to deliver this, we have Katie Rowlands, who is the Children and Young Persons team leader, and Hannah Knox, who is the Early Intervention Coordinator, both from Change Grow Live, may hear it referred to as CGL, which is the drug and alcohol service commissioned in Southwark that are able to support our young people and deliver work in schools. So Katie and Hannah, I'll pass over to you two.
Thank you. Thank you for having us to talk. We're gonna, I guess, just kind of give an overview of the main trends we see in Southwark amongst young people when it comes to substance use, and then how schools can kind of respond to that. We're hoping to increase your knowledge of current drug trends amongst young people in Southwark and the wider UK drugs market as well. And then we'll look at a few specific substances that we see quite commonly used amongst young people and have a little think about the effects and risks associated with those. And then also discuss how schools can respond to possession and or use in school. So we'll start off with cannabis. As you can see from the statistic on the right, this is the most common substance we see young people access and support for. 87% of young people accessing drug and alcohol service are seeking support for cannabis. Doesn't mean it is just cannabis. There might be other substances involved as well, but it is the most common one we do see. I think it is important to note that the way cannabis is being used amongst young people is changing. There's been more of a switch to THC vapes and edibles. So it can be smoked, it can be vaped and ingested orally through edibles. THC and CBD are the two main compounds in cannabis, and THC is the psychoactive part that provides the high. So we're seeing a lot more of solely THC products such as vapes and things like that, where there's barely any CBD in it, and this has a higher risk of things like cannabis-induced psychosis. So it's just really important to be aware of like the newer trends of cannabis products and the kind of specific risks associated with those. Weed in London generally does have higher percentage THC as well, with very little CBD, and there's also like kind of wider risk to the different ways of taking these, which we'll go into in a little bit more detail. So cannabis edibles. So you can kind of see some photos there of packaging that's commonly used for edibles. They look really familiar to sort of generic legal products, and a lot of the time there's a misconception that these are safer because they're advertised like sweets in colorful, familiar packaging, which can pose a risk of accidental consumption. So we see that sometimes like pets or younger siblings can accidentally take these products thinking that they're just a normal sweet. It's really important to pay attention to packaging. We're seeing a sort of significant increase in the use of edibles with young people, mainly due to the ease of access, and they're very discreet compared to like cannabis products, which has a smell to it. So often that will be a go-to for young people, and they might go a little bit more unnoticed in like a school bag and things like that. So it's just really important, like if bag searches or anything are being done, to pay attention to packaging, looking for sort of THC labeling and things like that. They are unregulated products, so like all cannabis products, they are Class B. And a lot of the time they're much stronger than other products because it's not being quantity controlled. You can have one pack of edibles and each one can be varying strengths. The packaging does not reflect the dosage of the product at all. So it should be responded to like any other illicit drug if a student is found in possession of this. Cannabis edibles are also often using county lines to kind of coerce and recruit young children. They can be sent via postal services and things like that and go undetected, and a lot of the time can be used for that purpose. And then THC vapes.
Yeah, hi. So I'm just going to pick up on THC vapes, as Katie mentioned. This is like another kind of more common way that we see cannabis being used nowadays, like a more kind of increasingly common way, particularly because in the similar way that edibles is a lot more discreet. There's not so much of a smell associated with THC vaping. Um, it's also very easy to get online, either online or also from some vape shops. And also it's kind of important to note if there's particular vape shops kind of near schools and stuff that perhaps are selling vapes illegally to under 18s anyway. They might also be taking other risks with selling kind of illegal products as well. So yeah, it's just important to know about kind of the fact that any vapes kind of confiscated at school, it's worth kind of taking a proper look at them. Yeah, keeping them kind of locked away because they might actually, they might actually have THC or being sold as THC products as well. They look very similar to kind of legal vapes. Sometimes it's hard to even like tell the difference. So yeah, it's just good to know that. Also, something to note about the THC vapes is that because there's no CBD found in them, it's like just the THC part that's isolated in the liquid. It's much stronger than herbal cannabis. So yeah, that's the kind of key thing is that the CBD part usually kind of acts as a protective factor against the THC bit. So the really strong bit that kind of is psychoactive and linked to more kind of psychosis and the high kind of effects. There's no CBD part that kind of counteracts that bit. So therefore it's a lot stronger and therefore a lot kind of like a lot more damaging to the brain and mental health impacts. Um, and yeah, some of the physical kind of signs that someone might be under the influence is similar kind of things to kind of that you might associate with cannabis. So like bloodshot eyes, drowsiness. And I'll talk a little bit more in a moment about the kind of differences between them and smoking a joint as well. Um, so yeah, kind of linking to this is the kind of contaminated vapes and the risk of illegal vapes being sold either as legal vapes, or I should say nicotine vapes. Um, yeah, there's actually a lot of illegal vapes that are, legal vapes that are containing products that are illegal. So this includes kind of vapes that fail safety standards, so they may contain excess nicotine, so higher than the regulated amount, for example, or other substances that which can be illicit substances, so like spice or THC, and I'll talk a little bit more about spice in a moment, or other kind of psychoactive substances, but it also can just be unregulated or toxic ingredients, even if it doesn't include illegal drugs. So yeah, kind of as I mentioned before, any kind of small corner shop that might be selling vapes to under 18s, they might also be selling kind of unregulated vapes. So it's just to be aware that any young person who is kind of vaping, they might be exposed to a lot more harmful substances than just nicotine. And in fact, like there's a study recently that showed from trading standards data that almost 2 million illegal vapes were seized in the UK in 2023 to 2024. So it just really shows that there's a huge increase. This is a big kind of increasing problem. And yeah, I guess the vape market is just, it's been really unregulated and it's been kind of poor enforcement and high demand as well from young users, which has made created a really like thriving market for illicit and unsafe products. So yeah, I think the key message for young people to know is that it's just really impossible to know what's in e-liquids, even if they think it looks like a legitimate product. It's quite likely that the product will be contaminated with other things. And it's also very impossible to tell by the color or the look of the oils and also the labels as well, because they don't really mean anything. So if any schools, again, kind of confiscating vapes and stuff, it's worth kind of seizing, holding the product, and even getting them tested as well can be helpful. Yeah, so spice I mentioned as well. Spice is a synthetic cannabinoid. It's a man-made kind of chemical that mimics the effects of cannabis, and is often stronger and more unpredictable. We often kind of hear young people might be aware of spice, not really know too much about it other than it's kind of fake weed, and maybe they think because it's kind of fake weed, it's not as strong, or it's not as like dangerous, and that's the opposite. Is actually true. It's often much stronger and much more kind of unpredictable. We find that young people are buying spice vapes, often sold as THC. So often they might be under the impression that it's THC vapes, but quite a lot of the time, yeah, it does kind of contain synthetic cannabis, so spice. We're seeing this a big increase in Southwark, definitely amongst young people, often buying very cheap THC vapes that do include spice. And the effects are just really a lot more severe, more damaging. We don't see so many kind of overdoses that are kind of just cannabis alone, but it's usually like THC or the THC spice that's in kind of spice vapes or edibles that are leading to kind of more hospitalizations of young people in Southwark at the moment. Yeah. And this is just to give a little bit of a kind of comparison between the three types, because I think that, yeah, the important thing is that the kind of the way cannabis is used now by young people has changed a lot. And so the smoking a joint kind of in the middle bit, that's kind of not as it's my kind of more increasing, that we're seeing people using edibles and THC vapes. And then it's good to kind of have a general understanding of the difference between these. So with smoking a joint, it's kind of quite a fast onset, can kind of intensify over 10 to 15 minutes, and effects can kind of last 1 to 3 hours. But we're kind of seeing a lot more kids, especially at school, when they're at school, using either THC vapes or eating edibles. As Katie mentioned as well, like there's not as much of a smell, and it's a lot easier for them to kind of do at school. And there's also kind of that sort of misconception around both of them maybe being a bit safer because they're not kind of, not smoking a joint. But yeah, as I said, that's kind of a misconception. They're often a lot stronger, these two products. So eating edibles is a much slower onset. They might take between 1 to 3 hours to kick in. Basically, kind of the THC goes into a young person's stomach before being rerouted to the lungs and other organs. So it's a much kind of slower building high, and it kind of results in a sort of full body high. And we do hear a lot of young people using edibles at school, and then kind of the effects impacting them much later on. So it's a lot harder to kind of take the dose, kind of to measure the dose basically with edibles and THC vaping as well. With THC vaping, it's a very, very fast onset. On the other hand, so it's a lot much quicker and kind of smoother than smoking. I think that's the other idea that young people have, is that it's not smoking a joint, it's not kind of going into your lungs, or it kind of goes in a lot smoother to your lungs, therefore it's not as bad, it's not as dangerous. But it's, again, that's kind of not quite true. It can also last up to about 3 hours, and also the high THC levels mean it's a lot stronger than top shelf cannabis, so just kind of smoking a joint. So generally it's just kind of good for kind of schools to have an idea about these different ways and how long it might kind of last for students, and what kind of things to kind of be aware of.
Thanks, Hannah. So just thinking a little bit away from cannabis then, and focusing on ketamine. This is another substance that we've seen a massive increase of use in amongst young people in Southwark, even as young as school age. So I thought it'd be good to touch on that. So it's currently a Class B drug at the moment. and it's a dissociative substance. But I would say it's quite a unique substance in the way that it can range from a very mild dissociation right up to being a very powerful painkiller, depending on the dosage of that drug. So we'll talk a little bit about dosage of ket as well in a second. But yeah, we've seen a massive increase in the use of ketamine. You might hear it be referred to as K, ket, special K, Kit Kat. There's lots of different like street names for it. And it's cheaper than other hard drugs, so it can be quite popular amongst young people. We've seen an increase in the way it's used as well. It's becoming more popular as like a party drug, but also day to day in like a microdosing kind of way. So yeah, we'll find that some young people or students might just take very small bumps of it throughout the day, so they might not seem very obviously or visibly under the influence, but can be microdosing on it throughout the day. So yeah, a 2023 study showed that 11% of 15-year-olds have been offered ketamine at some point, and that was taken across 185 schools in England. And I think that figure's probably risen by 2025. So yeah, it's kind of a risky drug in the sense that there's a high risk to contamination with synthetic nitazines and general contamination too. So yeah, it's really hard to know what's being cut into ketamine. It generally comes in like crystal or powder form. And I guess things to be looking out for is sort of evidence of powders or like powder around the nose. It's most commonly sniffed. Sort of small baggies, straws, or sometimes capsules, although that's less commonly used. And yeah, I guess the main kind of side effects you might notice if someone has used ketamine is sort of unusual sedation, maybe some confusion, difficulty walking, or disorientation. And I think that from recent studies, it's kind of shown that people aged 16 to 24 are 4 times more likely to use ketamine than those 25 to 59. So it is really popular amongst that younger cohort. There's quite a high link as well with ketamine use and EUPD, and also symptoms of anxiety, depression. So ketamine being used to kind of self-medicate these symptoms. So that's just something to be aware of, and we will go into a little bit more kind of detail on dual diagnosis later on. So yeah, that's an overview of ketamine, and then just having a think about like the kind of physical risk of ket use. So ket bladder is becoming an increasing like problem within the UK. There's a really good documentary and audio, I think it's BBC, Generation K, which is really kind of gives a good overview of the kind of rising use amongst young people. So yeah, it's more than doubled since 2016 and more than tripled in the under 25 age range. So K bladder is basically the term coined for like the damage caused to the bladder with kind of long-term use of ketamine. So it causes the bladder to become really small and painful. Can cause symptoms sort of like incontinence, painful cramps, and painful urination. And we can kind of see a bit of a vicious cycle happening where people will then use ketamine to manage the symptoms of their ket bladder, and kind of use it as a pain relief thing as well. So then it can just, yeah, become a bit exasperated. So yeah, that's just something to be aware of, I guess, as well, because I think a lot of young people themselves who are experimenting with ketamine or have used ketamine don't actually know about K bladder. So it's quite a big part of our sort of education and psychoeducation that we do with young people. And I guess it's, yeah, long-term use, like even when the damage has been done, can eventually lead to the bladder having to be removed. So yeah, it's kind of just good for young people to be aware of sort of the longer term consequences. So yeah, that's a little bit of an overview on ket, because we are seeing a massive rise in ket use in Southwark.
Okay, and just some other kind of prevalent substances. Nitrous oxide, we wanted to mention as well. We would say like this is very common amongst school age people, but not so much used in schools, in the school premises itself, but we often see kind of often see sort of like people, students being targeted at the end of school and stuff by kind of maybe like slightly older dealers who are selling balloons kind of around by the schools in the kind of nearby parks and stuff like that. So it's just, again, something for like schools to be aware of, and yeah, I guess kind of on sort of school gate patrolling and stuff like that at the end of school can be helpful. But yeah, nitrous oxide is a kind of dissociative, again, with mild kind of hallucinogenic effects. It kind of has had a bit of a change in the way sort of people use it. So Smart Whip, these kind of bigger canisters, are now a bit more popular way that they're used. And the risk really with that is that often you kind of end up getting kind of like a higher dose per balloon if you imagine those kind of like smaller silver kind of products before. They kind of like have a limited amount of the gas in it, whereas now kind of people can kind of be exposed to a lot more at once. It's a lot stronger. And yeah, we often come across like binge use as well. So people kind of who like use have like long-term or repeated use, and there's a lot of kind of long-term effects with that around vitamin B12 deficiency, which can cause nerve damage, brain and spinal cord damage as well. But I also notice as well that with nitrous oxide, it's sometimes often used again as a product to sort of exploit young people and trying to get them to sort of like start selling, start dealing nitrous oxide as well. So that's also something to kind of be aware of. And yeah, I think there's a bit of a common misconception about its legality as well. I think because for a while it wasn't illegal, it was kind of seen as a legal high. This is now this changed in 2016, but I think there is still a bit of a misconception around the legality of that amongst young people as well. And another substance we wanted to also flag as well is MDMA. Or yeah, these kind of names, other names that's known by Mandy, Pingers, pills, or E's. So ecstasy, MDMA is the same substance, most commonly taken in pill form, particularly amongst the kind of younger cohort. We often hear of people usually taking pills or pingers, like in schools. Sometimes that's usually the way they'll consume them, and can be kind of crushed and snorted, but yeah, more commonly taken in pill form. It's kind of it's a party drug, but I think it's important to know that these are kind of taken a lot more casually nowadays by younger people, often at the park, after school, even at school as well. And yeah, some of the effects, kind of the euphoria, kind of increased sociability, chattiness, kind of high energy, those kind of things, they might be a little bit more easier to spot in someone under the influence. So yeah, just good to kind of know that. And MDMA is a Class A drug, actually. So there is obviously big legal repercussions for possession of a Class A drug. So again, I think pingers are kind of done quite casually by young people, and I think there's a bit of a lack of understanding of the fact that it's actually a Class A drug.
And the last sort of drug we'll talk about is just thinking a little bit about benzos or benzodiazepines. Just to kind of touch on the fact that this seems to be making a little bit of a resurgence amongst a younger cohort. The most commonly used one tends to be like Xanax or diazepam. So yeah, it's a class of prescription drugs used to treat anxiety or insomnia, but you'll get a lot of like street benzos that are misused illicitly amongst young people, or maybe people using someone else's prescription, that kind of thing. A lot of the time people will combine it with alcohol or other drugs to enhance the effects of it. So that can kind of increase the risk, especially if mixed with alcohol and things like that. So yeah, I guess the main thing to touch on is the risk of synthetic opiate contamination amongst illicit benzos in the UK. So they're highly likely to be counterfeit and have other things like nitazines or fentanyl cut into them. And a lot of the time as well, like the strength of those illicit or street benzos will vary as well. So again, like risk of like sort of respiratory depression or overdose can be much higher. They can look really like legit packaging. And I think that that is, again, something to be aware of for schools, where even if something kind of looks legit, it's good to kind of check names on prescriptions, that kind of thing, or just have a bit of a closer look at things, just in case someone is using illicit benzos. And also it's quite unlikely to be prescribed amongst that younger school age cohort. So the effects are mainly sedation and relaxation, drowsiness, and impaired coordination, and then short-term euphoria or a calming effect. And a lot of the drugs that we've mentioned, the risk will always increase when they're being used together or with other substances. But yeah, that's kind of just an overview of the substances that we see most commonly being used. And it's not to kind of put that expectation on school staff to know everything about every drug, but it's kind of just to provide an overview of the trends that we're seeing currently. And yeah, give a bit of an overview of kind of how young people might be using those. And then thinking a little bit more closely about like neurodivergence or dual diagnosis in young people, there's several kind of studies and things that show that neurodivergent teenagers and young people are more likely to abuse substances like drugs and alcohol. So we think about ADHD and the kind of link between risk-taking behavior that's higher, and then also the prevalence of ADHD is higher in people seeking treatment for substance use disorder. So there can be quite a high link sometimes between managing sort of ADHD symptoms and like smoking weed, for example, because it can kind of self-medicate some of those symptoms. And yeah, self-medication can be really common in young people with neurodiversity or mental health issues. So sometimes they're either self-medicating symptoms of a certain condition or even medicating undiagnosed conditions. And I think like a very high percentage of young people who access our service, for example, either have a mental health diagnosis or a neurodivergence diagnosis or self-report concerns about that. So we do see a high link between that, and especially some self-medication to kind of like almost manage studies and things like that as well. So yeah, it's just to kind of be aware of, and understanding maybe there's a bigger picture behind someone's substance use sometimes. So it's good to explore that and then like link students in with any required support, any sort of like local school initiatives you have to support students with a mental health diagnosis or neurodivergence as well. So I just wanted to touch on that. And then moving on to the drugs market. So just thinking about actually where young people are getting their substances from or how. So yeah, mainly this is through social media. That has really increased. Snapchat, Instagram, TikTok, WhatsApp, there are now major channels for young people to be offered drugs or to buy drugs for. Tor browser as well. So this is a free browser that routes traffic to make it hard to trace where like a user is connecting from or what sites they're visiting. So it can let users access like the dark web and kind of make it easier for young people to get drugs, and also easier for young people to be exploited online as well, to kind of get in to sort of criminal markets and things like that. So the kind of key risks for young people is sort of, yeah, exposure to criminal markets and harmful content, and also grooming and exploitation as well. And then it can be a false sense sense of safety too. So it does reduce, Tor browser reduces some traces, but it's not a guarantee of like anonymity. So there can be things traced back to them as well. And then also sort of like scams and things like that. But yeah, I'd say that social media really is like the most self-reported way of accessing drugs that we hear from young people. So we'll have a little look on this slide about what that can kind of look like. So you'll see some photos there of like examples of Instagram stories or posts, or like drug menus that are really commonly sent out or posted via Snapchat and things like that. And it's really like blatant in terms of like how it's promoted, but then often switched over to like a private encrypted messenger. So yeah, Snapchat and Instagram are the most popular platforms for this, but also it can often be moved to WhatsApp and things like that. So from a study of like 16 to 24-year-olds, 1 in 4 young people reported that they see illicit drugs advertised for sale on social media. And I think that like from my own experience working with young people, it's like a very high percentage of them will have come across that at some point. So yeah, the main online safety advice for young people is not to accept unknown follow requests, not speaking to people they don't know, not purchasing products online via social media, and then just kind of general awareness raising of like the wider risks that this can cause for them. Some of the other ways young people are accessing drugs can still remain from like older friends, maybe older students or peers, can still be quite a common route for them. Also, county lines gangs can recruit and exploit children to sell and transport drugs. And like we mentioned earlier, that can sometimes be done through like edibles and NOS quite commonly. And then, yeah, the drug menus that are kind of shown on the right are shared publicly and then often moved on to private chats. So that kind of is, I think it just shows like the shift of the drugs market and how much easier it is for like younger age children to access and become so exposed to it from quite a young age. I think it's also worth mentioning that like there's quite a lot of misinformation that's shared online about drugs, especially on like TikTok. We'll see certain trends that are being promoted around different drugs. There's things called like ping talk, which really like glorifies like the use of MDMA and gives a lot of like misinformation about that. So a lot of what we do is like myth busting with young people as well, asking them what kind of information they've come across on social media and kind of unpacking that with them to give them the facts about drugs. So yeah, that's just a bit of an overview on like the drugs market and social media.
Cool. Yeah, and kind of following on from that, talking about how schools can kind of respond to this. Kind of following on from what Katie was mentioning about myth busting, I think that kind of kind of education preventative measures beforehand is actually really key to do kind of before incidences happen. But you know, as we kind of said, like a lot of young people are really exposed to substances nowadays. It's a lot easier for them to get hold of them now, and it's a lot they're a lot stronger as well than perhaps they used to be decades before. So I think it's just the first kind of 3 points here about kind of are a bit more sort of general kind of preventative things that should be done around ensuring that students have kind of up-to-date information sources of help, making sure staff as well have some kind of like general substance awareness training and sort of first aid principles as well in case a student is sort of like under the influence, and also like preventative kind of education just all around is helpful. But generally, if there's an incident and someone is under the influence at school, it should be kind of treated as a medical emergency, prioritizing the young person's safety first. So first aid, recovery position, that kind of thing. Emergency services as well, ambulance is always just always like very important. Again, as I said, kind of the substances that we see young people using, they're very strong, and also the effects of these substances are more likely to be more harmful on younger people than adults. So yeah, always kind of treating it like a kind of like high emergency is the right thing to do. Yeah, seizing any illicit products and storing them securely, and contacting 101 or your local kind of local community officer. Yeah, then kind of following standard safeguarding procedures. We recommend always making a MASH referral as well if this young person has been using substances a lot, if this is or if they've been, they have a lot of products on them, or just anyone, any young person who is kind of exposed to substances, like a MASH referral. It's always good to for schools to cover themselves in that respect, but also for there kind of to be like further investigation around what's going on for that young person and why they've kind of been able to be exposed to such drugs like this. It's also like helpful, if possible, to kind of ascertain what the young person's used, and kind of find out a bit about like how much they've used, how often. But again, we kind of say if this doesn't feel appropriate at the time, or if they're not verbal, that's fine. But I think sometimes helpful to know a little bit about what they've used, and yeah, then kind of a referral to the local service. So for Southwark schools, that would be us, CGL Southwark. And it's just, I guess the point is that it's not school's job to know kind of everything, and to kind of like, cover all bases regarding that. But it's just for, you to kind of like know what to do in that kind of initial moment, and then the referrals to make, and like we can kind of take it from there. Yeah. And yeah, we just wanted to also kind of following on from that, kind of give some pointers around sort of general kind of substance misuse if it's not sort of like an emergency incident, if it's more a disclosure or something at school, just kind of some tips and conversation points to kind of hit with the young person. So just kind of maybe goes without saying, but like approaching the subject really sensitively and having a non-judgmental attitude. I think with young people, that like, and kind of opening up about substance use, there's obviously the kind of concern around disciplinary action being something that's kind of puts them off from maybe opening up and reaching out for support. So yeah, I think we just kind of encourage that kind of approach of looking at the bigger picture rather than just the disciplinary response. Finding out a little bit about why, and asking open questions, understanding a little bit about why the young person is using, or asking that question. Keeping the conversation open, asking them about their own concerns around their use. Basically letting them know where support and advice can be accessed. And also, kind of, I guess the support is more effective basically when students feel that they can be open, and feel safe to kind of open up about what's been going on for them, what they've been doing, without fear that they're going to get immediately expelled and locked away in prison or something. So I think just kind of having that approach is helpful, and often we find sometimes, not always, it's given by schools.
And then I guess just thinking a little bit about the main approach that we adopt when working with young people. So that's sort of like a harm reduction approach. So that's basically an evidence-based, compassionate approach to drug use. So it focuses on keeping people as safe and healthy as possible, recognizing that young people will likely be exposed or experiment. So it's providing practical strategies to keep them safer rather than relying on just purely abstinence messages. So harm reduction interventions have been sort of studied, and they show that risky behaviours are reduced and engagements improved with services amongst young people whenever a harm reduction approach is taken. I think, like, following on from what Hannah was touching on about reducing stigma and not like judgment-free support, that's sort of what it embodies. So it encourages that help-seeking behavior rather than punishment. And I think young people are more likely to engage in like psychoeducation when it comes from that approach. So yeah, we provide practical strategies, like honest information, safer use advice, things like needle and syringe programs, naloxone, and drug check-in. It's basically prevents immediate severe harms. That's the goal of it. And a 2021 study, I think it was by UCL, showed that almost a third of 17-year-olds have tried cannabis and 1 in 10 have tried harder drugs such as cocaine, ecstasy, and ketamine. And also that like 12,000 under 18s were in contact with drug and alcohol services in England, and that was between like April 2022 and March 2023. So I think both of those will have increased a lot in the last few years. And it kind of just highlights the sizable need there is for interventions, and that drugs are being used amongst young people, so we need to keep them safer, even if they do choose to do that. We're always very clear in terms of like abstinence is the only sort of guaranteed way that you can be fully safe. But if you still want to make an informed decision to use that, then this is some ways that you can be somewhat safer with that. And we recognize that that sort of messaging can be a little bit more challenging for school staff to deliver sometimes. So that's where we kind of come in. We recognize that, and we can always be signposted to kind of deliver that support and intervention. And I think just following on as well is early intervention is a really important part of harm reduction, making sure that students have access to support and education and like factual knowledge about substances before they've reached that age of experimenting with them, because that's going to keep them safer and kind of give them more awareness of kind of what support is out there, what resources are out there if things maybe do go wrong, or if they want a little bit more support around things. One example of like a good online tool is on Drugs and Me. So it's like a drug interaction tool. So you can see an example there of ketamine and benzos, and it will kind of rank the safety level of mixing those things. So you can see that this one's unsafe. So yeah, it's quite a good tool for young people to kind of use, I guess, to gauge what combinations will be more risky to them, because we do see a lot of like poly drug use, especially at that age when kids are starting to kind of like go to parties or that sort of thing and experiment in more social settings with substances. So yeah, that can be one really good online tool. But yeah, that kind of wraps up what we wanted to share with everyone. Basically, yeah, while no drug use is always the safest option, we know that young people will experiment, and absent messaging doesn't really work that well. So it's just kind of ensuring young people are aware of the substances that are out there and the current trends. They can make their own informed choices. And yeah, preventative substance misuse awareness and harm reduction advice is essential to kind of keep young people safe. Drug trends can change really, really quickly, and I think that's what we wanted to kind of highlight today, especially amongst like the online drug market and the way sort of like cannabis products and things like that are being used. It's changed really quickly in the last few years. So yeah, it's just highlighting those changes, so you can kind of listen out for that amongst young people, and know how they are accessing certain stuff. And then sort of yeah, the main point is it's not your role to know everything about every drug. The main thing is just responding proactively if there are any incidents, being compassionate and knowing what support is available for young people to link them in with. And then a little bit of an overview on what we provide. So yeah, we work with up to 25-year-olds in Southwark. And yeah, we work across schools, like youth justice services, like universities, up to 25-year-olds, and we could do this in a range of ways. So if, for example, if there was a student of concern or a student maybe who had presented at school under the influence or something like that, then that's a really good opportunity to signpost them to us, and we can provide like sort of that confidential space for them to get one-to-one support. And then we also do sort of like organised group work or workshops within school settings. And that could be tailored to kind of whatever trends or needs you're seeing in your own school. We do professionals training, and that can also be tailored as well to sort of different professionals and who you're working with. And then, yeah, we adapt support basically to meet the needs of the young person. So we have like a evening service here on a Thursday where we can see under 18s up until 8 p.m. And we can do them in school, basically wherever they're comfortable. So yeah, that's a little bit of an overview about what we offer. That is our contact information and referral link. So all referrals can be just made via our website. It's quite easy to find. It says referrals at the top, and you can just put in as much detail as you can. And it's always best to kind of have that conversation with a young person before the referral's made, just so they're kind of aware of it at least, or somewhat on board and know who we are. And then we can kind of take it from there, I guess. And give them a little bit more of a confidential space to explore any risks and kind of work through that. But yeah, that is pretty much an overview of us. And if any kind of questions arise after you've like viewed or watched this session, you can reach out with any kind of general inquiries like that. Or if you have any training needs as well, you can reach out. Yeah, that brings us to the end of our presentation. So thank you.
Thanks so much, guys. I actually have a question. You said about kind of making sure a young person is aware of a referral where possible. And I was just wondering what the extent of their buy-in needs to be at the referral stage. I'm wondering if schools might have a situation where they suggest the service to a young person and a young person might be resistant. You know, they might say, I don't have a problem, I don't have an addiction. Does a young person have to be entirely on board and absolutely willing and happy to engage at the point of referral, or is it possible to almost refer a somewhat reluctant young person, have you guys do some of that initial work before they're fully ready to engage?
Yeah, that's a really, really common situation, because I think a young person can hear like drug and alcohol service and it's quite scary, and they can get their back up a little bit. But yeah, as long as they kind of are aware of their referral, that's sort of enough. And I think a lot of the time when we go in and sort of have that initial conversation and actually can break down a little bit more what that support looks like and how it is confidential. So that doesn't mean that we need to report back on like every single thing they're using, and they understand like the sort of safeguarding and confidentiality side of things. They're usually a lot more open to support. So yeah, we're more than happy to like take on any referral when they know about it and have that initial conversation. So yeah, that hopefully that answers that.
That's great, thank you. Thank you both so much for that. Really, really informative. Really good to be aware of some of the trends in Southwark. I think especially around the way that risks are changing, the way we spot risks need to change with that. So being especially vigilant around cannabis or THC, vapes and edibles, and understanding how we look for these and how we support young people to be able to keep themselves safe as well. And really good to know about the extent of the work and support that CGL can offer. So not only when a young person is known to be experimenting or having difficulties around drug and alcohol, but also that kind of wider preventative work that you can deliver in school, both to students and to staff as well. So thank you so much. And just a reminder to schools to reach out to CGL for any support.
Thank you.
Thank you.
Thanks, guys.